Dehydration is a condition that occurs when an individual has lost so much fluid that the body can no longer function normally and begins to develop signs or symptoms due to the loss of fluid. Oftentimes, water moves out of the body faster than it is put in. People and animals lose water every day in the form of water vapor in the breath we exhale and as water in our sweat, urine, and stool. Along with water, we also lose small amounts of salts or electrolytes, which are necessary to maintain energy and hydration in the body. The state of dehydration can affect the body in many different ways. These effects are determined by the severity of dehydration a person is suffering. Doctors and researchers say that there are 3 stages or levels of the condition. You can either be mildly, moderately, or severely dehydrated. The difference between these stages is that mild and most moderate cases can be reversed with the intake of fluids, whereas severe cases are much more difficult to treat and put back in balance. With all of these levels, a lack of water causes a lack of blood flow throughout your body and to your organs, which, depending on the severity, could result in death. Symptoms correlating to dehydration are often different between adults, children, and infants. In adults, the most common symptoms are dry mouth, sweating less than usual, dark urine, dry skin, and dizziness. For young children and infants, there is usually no tears when crying, a dry mouth, high fever, drowsiness, or irritability. It is important to know some ways that you can avoid or prevent dehydration. The main prevention method would be to make sure that you're drinking the correct amount of water for your body on a daily basis. This amount differs for every person, so you can always ask a doctor or medical professional if you are unsure. Additionally, if you are being active in warmer temperatures, sports drinks are helpful to maintain hydration throughout activity. Finally, try to avoid drinks containing lots of sugar or caffeine, as these tend to increase the risk of dehydration. There are some times when a person is more prone to dehydration because of some specific risk factors relating to the condition. For example, if you are sick and have symptoms such as fever, vomiting, or diarrhea, you are most likely losing fluids faster than you're intaking them. You are also at a greater risk if you suffer from diabetes or if taking certain medications that increase fluid loss. Lastly, excessive perspiration, especially in extreme hot temperatures, can result in being at higher risk for dehydration. Similar to most illnesses and injuries, dehydration can come with complications if it is not treated or resolved correctly. One possibility is organ damage, such as kidney failure or swelling of the brain. You can also suffer from heat damage, seizures, or even a coma leading to death. Lastly, the body could go into hypovolemic shock, which is when the body's blood volume is very low. Finally, if you should ever suffer from dehydration, here are some ways the condition can be treated. The easiest way is to simply replace the fluids you have lost by drinking lots of water and electrolyte-filled drinks. If you are severely dehydrated, the best solution is to go to the doctor or hospital where they are able to give you IV fluids and keep an eye on your overall health.